Now, one of the things I have talked to you about in the past is what I call an acidic diet causing osteoporosis. An acidic diet also causes high cholesterol, high blood pressure, and many other conditions. And what is an acidic diet? Animal protein is what is the most important thing in predisposing to an acid diet. Acidic acid. So when you eat fish or chicken or meat or cheese or eggs or yogurt or cottage cheese, you're taking in animal protein that contains a lot of sulfur. That sulfur is converted to sulfuric acid in the body. That is the acid that I'm talking about. And to neutralize that acid, phosphorus comes out of the bone to neutralize that. And bone is calcium phosphate. So as a result, there is no, the calcium is hanging on to nothing and it goes out the urine, and that is what weakens the bones and causes bone loss. Now I recommend potassium citrate. I recommend a less acid diet. I recommend less fish, less chicken, less meat, less cheese, less eggs. And once again, we're back to rice and beans and vegetables, and that's more of an alkaline diet. Half-dose influenza. I have been offering my patients the chance to have reduced dosage flu shots. Some people are made ill by the flu shots, and as a result, I give my patients the chance to have reduced dosage flu shots. And here is the article discussing that, and basically it said that it was effective. They gave several considerations. This is from the December 22nd Archives of Internal Medicine, 2008. So again, reduced dosage flu shots, and you can discuss that with your physician and perhaps take the lower dose under the skin is the main one that I recommend, because there are more immune cells under the skin than there are in the muscle. So as a result, you get more of an immune reaction. That was one study that was done that showed that giving 1/5 of the regular dose under the skin was just as effective as giving the full dose. And there are a fair number of patients of mine who either caught the flu at the same time or call up and complain and say, after that flu shot, I got the flu. And I honestly believe that in some people there is a relation for that. New England Journal of Medicine. I've talked about this journal many times, and let's see, there we go, here we go. Oops. That's what an article from the New England Journal of Medicine looks like. And what this one is about the medication Crestor, and in patients who had what were called normal blood cholesterols. Now, as far as I'm concerned, they weren't normal at all. A normal cholesterol is between 90 and 130. And what I usually talk about as for the proper cholesterol level is to subtract the good, the HDL, from the total, and that number needs to be less than 90. For instance, some people have genetically high cholesterol, but they have huge amounts of the good cholesterol. And it is conceivable, although I've never heard of such a thing, it is conceivable that if you had a good cholesterol of 210 and you subtracted that from the total cholesterol of 300, that would give you the 90 number that I'm looking for, and therefore no treatment would be indicated. Now, I've seen high cholesterols, usually 250, 300, with good cholesterols of up to 120, maybe even 130 or 140, but I have not seen them 160 or 180. But I want to give that idea to you. Subtract the good cholesterol, the HDL, from the total cholesterol, which is, that gives you all of the bad, and when all of the bad is reduced down to 90, as was the case in this study called Jupiter, that hardening of the arteries and heart attack and stroke and death and all-cause mortality were reduced by about 30 to 50%. 30% for some of those, 50% for others. Now what that supports, that gives two pieces of interesting information. And one piece is that why didn't it go down to 100% if they reached the non-HDL cholesterol that I recommend? And that is because there are other factors involved. There are other factors like overweight. Simply being overweight is a risk factor for heart attack. Also, there's lipoprotein a, in which case your value should be approximately half or less of what the range is. So the range may be 0 to 30, in which case your lipoprotein a should be around 15 or less. What about homocysteine? Homocysteine goes up to around, we'll say 15. Your homocysteine level should be around 7 or less. Your A1C should be around 5.5. Your 25D3 should be at least 50 with a goal of 80. Your percent body fat should be such that you can see the clear lines of definition. Your blood pressure should be 115/70, and so on. And so those are the factors that will tend to reduce your risk to almost zero. And I have a number of patients who had an event happen many years ago, and I was very aggressive in their treatment, and they have had virtually no recurrences of their hardening of the arteries, need for angioplasty, open heart surgery, or whatever. Now, let us talk about, the people who got the most benefit in that study were the people who had an elevated cardiac HS C-reactive protein. And that was brought down from about 4 to 2. And that was one of the factors that was related to the development of heart attack. Now, it turns out probably 10 to 15% of your risk of heart attack is due to the cardiac C-reactive protein, but it definitely sort of identifies who is at greater risk. And the majority of your risk of heart attack is due to the presence of a non-HDL cholesterol. Subtract the good from the total, subtract the HDL from the total cholesterol. That gives you the non-HDL cholesterol, the non-good, meaning all of the bad. And when you get that down around 90, that pretty much stops hardening of the arteries. Now, in that same direction, treating diabetic patients to very low lipid level reverses hardening of the arteries here in the neck. Diabetics are especially predisposed to heart attack and stroke. And so what you do is when you get that non-HDL level down to around 90, then that correlates with an LDL, which is the main but not the only portion of the bad cholesterol, of around 55. And that's what was found in that Jupiter study, and that was what was found here in this study, which I believe is the SANDS study, if I'm not mistaken. I wonder which, SANDS, this is SANDS. So if you're sufficiently aggressive, and they did use that medication, they got a bad rap for a while, which I told you I thought was okay. I think Zetia is a very helpful medication. And so I did not stop using it, I have not stopped using it, I will not stop using it unless there's some clear information that it is definitely causes some abnormal problem.